Speech pathology is very interesting in that it's always changing. There's always a new development, there's something new going on in it that you can't just learn it one time and it's a theory that you'll forever remember and recall on a test. It's not something that you just regurgitate, it's something that you use and develop and hone every day. It is medical in a sense, but it's a helping field. We're very much so in it for, seems bad to say, but for the rewards, but at the end of the day, it's very rewarding regardless of who you've seen or what progress you've made. If you're kind of making that connection with the client and when you make it personal for you, it's kind of the point where they let you in. The really important part is treating the individual, treating them as a person first and seeing the disorder or the diagnosis secondary to who they are. It's not at all about, I'm going to treat this and we're going to fix it within 6 months. It's very much so, okay, you're struggling with something and I want to get to know you and I want to get to know how you feel about this and how it's affecting your life and your quality of life, and all of the everyday aspects of it are really how you have to tailor your therapy. I really enjoy the relationship side of therapy and kind of the trust that comes into it, but also I enjoy the research, so I enjoy being able to tell them, this is my rationale for doing what we're doing, and you know, it's very structural and a very strategic plan that goes into it. There's a really wide array of things that you can choose to do once you're out and your license covers all of these things, so it's a big decision deciding where you want to go. If you want to work in a nursing home or a hospital or a school, it's all very different. The nice thing is that you can always switch. If you decide that, you know, after a year you don't like this setting, you can move to a different one. The program itself is really collaborative. So the faculty, as far as the clinical faculty go, they do a really good job of not just making it about a grade, about watching you in clinic and giving you a grade afterwards, but I mean, you have meetings to talk about, this was great and you were so natural today, and let's talk about any of these things that are going on in life besides the fact that you're my clinician, you're a person to them too. So they kind of integrate that teaching methodology that, you know, it's not just about the grade or about the student, but them as a person. So I feel like I've had a lot of faculty, both clinically and academically, pour into me, which has been a really nice experience. It's really encouraging, feeling like they must feel like you're worth their time and effort because they're putting a lot into you.